Why is long-term osteoporosis fracture prevention hard? Long-term prevention of fractures in osteoporosis can be quite challenging. This difficulty arises from a mix of factors related to the disease itself, how well patients stick to treatment, and the limitations of risk assessment tools. Osteoporosis is a condition marked by low bone mass and the deterioration of bone structure. This leads to increased fragility and a higher risk of fractures. Often, fractures happen without any warning signs until a serious event occurs, like a hip or spine fracture. These silent developments make it hard to identify the problem early and manage it consistently. One significant challenge is accurately assessing fracture risk over time. Tools like the Fracture Risk Assessment Tool, often referred to as FRAX, help estimate the chance of a fracture happening over the next 10 years. They consider clinical risk factors and bone mineral density. However, these assessments have their limitations. They may not fully account for changes in risk due to aging, new health issues, or the effects of medications. Additionally, access to advanced diagnostic tools, such as dual-energy X-ray absorptiometry, known as DXA, which measures bone mineral density, can be limited in many areas. This scarcity reduces the ability to monitor patients effectively. Patient adherence to long-term osteoporosis treatment is another major hurdle. Treatments usually involve taking medications over an extended period. Some of these medications may have side effects or complex dosing schedules, which can lead to poor compliance. When patients do not stick to their treatment plans, bone loss continues, and the risk of fractures remains high. Moreover, managing osteoporosis requires a tailored approach. Factors such as age, sex, existing health conditions, and lifestyle choices all play a role. The variability in how patients respond to therapy and the need for ongoing reassessment of fracture risk add to the complexity of sustained prevention efforts. In summary, long-term fracture prevention in osteoporosis is difficult because the disease often goes unnoticed until fractures occur. Risk assessment tools have their limitations, and access to diagnostic resources can be scarce. Additionally, patient adherence to treatment can be inconsistent. Effective management requires regular monitoring, personalized treatment plans, and strategies to improve adherence to reduce fracture risk over time. Always consult healthcare professionals for personalized advice and treatment options.